I am Dr. Vibhore Singhal. I am Senior Orthopaedics Surgeon, Joint Replacement Surgeon in Venkateshwar Hospital, Dwarka, New Delhi, India. And I have with us a very gentleman, Mr. Lintz, who had a fracture in 9th of February this year on the right hip, and his acetabulum, which is the cup of the hip, it got broken. When it got broken, it broke into a lot of pieces with a lot of shattering, and his hip was totally destroyed. At that time in his country, he was not able to get proper treatment because he had a severe diabetes, and he had neuropathy where the nerves of the lower limbs were not working. He came to us in December, and I decided to operate on him after some medical checkups and medical treatment. And we were a little skeptical because he had a lot of comorbidities. It was a very difficult case indeed. During the surgery, I took out the hip, the bone from the extra bone from the hip, the femoral ball, and placed it onto the acetabulum, to the cup, because his hip was riding high. And I made the whole acetabulum with the help of that extra bone, and then got the cup and the stem placement, and the surgery had gone so nice that he was walking after 2 days. So Mr. Lintz, what was your experience? That's from my side, but probably you must have your honest opinion. How did you feel over here?
Feel very good.
Okay.
Yeah, the surgery was very nice and successful, and don't really know what to say, so I want to thank
Actually, yeah.
this guy. He was very honest by telling me everything what I'm going to be experiencing. So yeah.
So how was the pain? What is the difference between what you walked before the surgery and after the surgery? Did you have any movement, increase of movement, or you know? Yeah.
Before I cannot even get up from bed by myself. Now I can do it. I can just feel the pain gone from my hip. I can feel the bone before just cracked. Right. I don't know how to say it, but it's always twisting, dislocate. That's how I feel it. Now, no more. It's better. Yeah.
And day by day, do you feel that you're getting better? And you hope? How's your hope?
Yeah, I'm feeling better every day, and hope to go home with my family.
So, because of the diabetes, I think you had some apprehensions before.
Yeah.
So, could you tell me about what apprehensions did you have, and did it got okay?
Yeah, my diabetes I cannot control from Nauru. Now I'm staying below 100, like 150, 118. Yeah, the diabetes I think is better, not same like before. Yeah.
Probably because all the derangement from inside has gone, and now you're able to walk a little better.
Yes.
And the diabetic control, of course, you're aware of it, that you have diabetes and that can ruin your hip. So that's a good thing. Overall, how was your experience over here from all the staff, etc.?
Yeah, the staff here, they are all good. They're very nice people. Yeah, everywhere I go, people are nice.
What message would you like to give to people of Nauru that,
Nauru, people of Nauru, this hospital is very good. Mm-hmm. Very nice hospital. Yeah.
So that's great. I think Mr. Lintz over here is not a very expressive person, but with his facial expressions, he has explained everything. That he was very skeptical and he was very scared when he came here to get his treatment, but the treatment was with all the precautions. We got it very successfully correct, and now he'll be going home. Thank you.
Thank you.